hey asemo we dey say be kan abosom be so nti we dey me fancy an yenko the topic ni not all genital discharges are not discharge is infection o say nya bibi e so ni so ni so bia na eye yarewa nti the edi kan doctor please define what infection is. We must understand that word na afi ye hu discharge no so genital dey say obi anim wo ye oba unim me koka say o mbeka say me ye we wo ye oba eye pussy wo ye oba ma eye dick me koka ni twi di o mbeka say masai kora nti ene me nka but dem ka kakre say eno so nyo da sorry eno dey ye nim genital but what is infection and what is discharge?
All right, so kind infections are yaremwa eba yemu na enye the bias no kwa ba hu say nsu gu no kwa even ulcer infections, typhoid infections. It's infection eguma hodro aha ne momu no ye pese na charge ne ko genital one de no de ba ye ba na ye be ma no ho de no na ye pese hwe pa infection generally means say yaremu bi aba mu even malaria infection parasite so bi aba mu na e abo na de abro e be cause germs and a microorganism yes when your infections into your bebre by na brain in ne be se hwe de kan genitals no e ba was be ma wase no ene cause discharge ensu efiri oba ni ma so obema ni mu eba ene pese cause bibi sa se ensu ogu a enche so when infections so to obo ase na uja se hu ya na okoto aduru na wonom and that's the problem today and then for abuse antibiotics no be do e bi no ye nya antibiotics pa kra nche obi so nkoto nom because e money di kan hu
onu ma
emfa e money already train aduru no say mra e ba obetwe akwese ya bo akra na obebo na afide onfa ho biem nti e money hu nuru no sisi e say bebi edu owi asem no e fa de bi antimicrobial resistance e money fight nuru nti obi anom na no bi sani nuru anom me hwe nuru no just e wanu na esi den fa mo biem wanu mapem nti e basa na very problem and the issue a man krofa business no na esa de we hu senso gu na any infection no akọ draft no akọ pharmacy na onum nuru and that is where we are today ye pese e chim na ni pe nya enlighten hu so discharge bia hu bia no to bo ashe na infections.
Okay, discharge, no, I think you have to I think so you have to take your time and explain types of discharge yehu ewo yewe no because when you are sleeping with somebody you discharge both people. When you play with yourself you can still discharge.
Exactly.
So tell us which type I mean types of discharge yehu ni yehu ni say ye yare dia yehu ni say your body now for me ye dia yehu ni say where the be wrong like I mean give us types.
All right, okay. Inti yenhwe the entire ohaw no now your chlamydia infections bo be friend trichomonas me can first me coach we trichomonas it me the sa chlamydia infection ne ba na your gonorrhea na serious gonorrhea ono so to be gonorrhea ne ba so nya syphilis and more discharge the for kwata confuse pa common ones by gonorrhea and chlamydia no now your a mouse de ba ko a e tar friend no bacterial vaginosis and also ho aha any your trichomoniasis and also ho nti these are the common infections a time nya discharges both a man and mema na yinti ni pa say yes infection ya make kan bia empempi no enso na eba no e ya na ye greenish kakra light greenish ebu ani tun brown kakra ebu kwa yellowish na ya na thick then again na san bon pa so ase kusuya ase nambia so hu san dia it is telling you say it's an infection even that one no, I also plead say laboratory and our conclude doctor on show na koye sa test na confirm ni ehwe now ebi o nso a obehwe na ebi sometimes no wonya kan da hyehyɛ no so man ntuminya ene efe no deep one as white no it's because of the discharges no and initial no so pa say infection apart from say yes our colors ya making na fe e born no utanya painful urination one obema kra na obe out pains say ebi o sperm say ba na obema hu sa pains no nti saa de ye yare no it is accompanied with this enema e ka ho ka bom nti oba consult na ya na e do history bi so questions be brave asan e tumi hu say we na say that never but who discharge na no form ya do timi say yare by wada nema ye hwe bisa ehu then we take the process from there ni diagnose ehu nti so hu emu bi ye pampan e bon ye eni green kakra eni yellowish kakra sometimes no pains and our sensations our see ho show ene Maame Grace e kire say e yare bi abo bi na aba ho ene e ha wo ni akola ni akohwe de mekan ye bi say you go no e white e bia chlamydia, then we take it from there.
Question baby said I know because what we say, we didn't know tuberculosis, malaria, measles, HIV. I can mention and mention and mention. We were here. We didn't know about any topic one any. So niama oboboy boy obobo mudi na unso mu yino mu ni twidi abrofudi no
yes why
if you hin abedu ha how because anytime a sickness bebe bia or the abrofudi if you ho na e ba omo aso na omo wo na eduru na e ba so beto yen wa ha enko biom na abeka yare na weibo na aba na abeka weibo na aba na abeka enko da
yeah
eye nkrofo na create yare no ana so say enduane ayedi so wo bacteria sibum ana bacteria wo nti enu emo wa aduane na ayedi nti enu so na create ana say dem because me person me tia say nti any twidi
say ye hwe yare mu na e kana apart from white no dia kan na enem yare and don't more if you say if you best 90s ni ba na we say globalization kakra you took one ye fa ha ye ko haba nti mo na ye di nkita ho na ye di dwa no na ye san nya nam nkita ho die frafra no ene ko sade no
ya ko twetwe ne man ba
tsenke bia nka ye ne atiga ne ntukwan a ke ne be ye den se de ken then we can look into it so the be na share that be share baby na ye ko fa na be wo ye ana
ye tu kwan bo ne yan ko hye so a
be here's the case say Ghana ni okro bia biase baby benya Ghana ni ho
of course
yes nti by so doing you know e ya na to contract and at the ten say oba no ye nso settings na ye be ka say almost nka ya de nka de pa ne local medicines no autonomous medicine na issue and if you about for never into here laboratory devices never be ready ya you be organic for never in room be na ho never nti research ahodo a de hwe no e ho na pempinye taye no en say makosko akra South Africa and na UK nti wo hwe research e was our countries na ya na kon kan kwa anim chen de wa ha no nti ho na me yehu some of these things and na you know say na kwa nipa muja kona wo yum nti aboa bi kamia broni so nipa wetuma nya sa aboa na nti etumi de mai ho because of saying na the same human beings homo sapiens no enti meka ne say nipa frafra ne akona bedie ni enam kitahudi ekoso no ene mai nya dwane di enti obetumi so oni oba bia nhia da okodware nsuo ni ade and infections the UTI akra we are type cancer hasem enti the chane say the kan die strictly by sex be ma ne oba kitahudi enti watu kwan ni broni bia kohia one channel ni de ni akoshi wetin afa yare ndi abaga na oba no bi beda be ma no nti those are the very same nya sa enema no
so there's no way anybody can be born with such sicknesses
where they tell you minchim kakra your congenital ones and it say the wo so it is there but ya na mpempi no and akwa ni so na o how metahu your sites nti sa condition e kan gonorrhea, chlamydia, syphilis, yetade wopa, very important so bisa. Titru oba bia te o your banete also. Na unyanware ya na unyanwa treatment in free ho and they are all treatable. So when treatment in free ho net sound so between the ama akra wo no. Ti nkura pinanya any eye problems, otitis, fence omani yare, omani so no ahyensuo prinsuo ni ade. They are all due to these STIs. Nti encroach it of course congenital nti za kra nya na so being harvesters no nya it means any maame na e de ma no
ana ne papa nka ho
say on say Maame Grace akra na da maame ne yem na se ho no fi feed no nti say ma papa nya na say oba ne kra ya na ntimi nya age oba ne nya e na otwe de wo akra because of so few ase ho pia
because o ho not
that's right na oba na nini so fa ase ho na eba so that is why it me
no abeti tibi wo ho na mwa be no mo ni edin sa
nti ma hwe couples are so me say maame no obi papa obi nkrani na nso obi nti mo mo sala na ehwe o mo
this question would sound biased but let me ask because looking at a man no ho no it is believed in fact we are medical doctor you should know that they said that place is the most healthiest place nti sa mwa we omo ba ho all the this hard acidic urine na efa ho ba no enye omohwe omo bewura ase ho a omo duele ewo nerves ni mu body ni mu blood ni mu skin ni mu he fa no mu duele a ma no release all these acidic things from their there entimi nko omo na enyo omo hwe
de tie ni se yase ho no ma se ho no emo aso te ho pa
yase ho no ada wo
so emo ase ho no e fe bi normal flora your bacteria nyankopan so montena ho na emo awo omu na bacteria nti o me betena ho no omba format for na for so they able to also adjust the condition nti na ohu nsuo e ho hyehye no no nkan obeto abai ho so wote ho we go ninu anum biti ho no dada e na obeka mo ho no nyomo te
ho reactions
exactly so ati asia ha nti we asho de mo ne say nsuo begu e ho be hyehye ho be yoya e bitu affect wa wode ani ade nti ideally so you healthy oba umpom di gina so kama emo ne ba they can't stay there because bibia okay but moment I be compromise o immune system ne be ba form no system ne be drop no then the omunya
konya opportunity to stay there
that's it nti emo be from an opportunistic bacteria onya konya na waka ho nti oba bi ho a onya exposure to those bacteria but mun twin no so because the system is strong and healthy always fighting bacteria some fake ones no. But what are compromising no? In terms of it antibiotics it bacteria I say name okay sugar because we salamana you help them to even stay there and grow more.
That's what they feed on.
Aha. In the obenge infection na nkwa the tiene say sa oba no or immunocompromised system no weak. Na se ho condition no a pavy way say Mohammed na ho. E na e create this no.
Now there be pavy is way no that is one. Some are saying that it's about sexual intercourse. Let's look at them kolanimu titiri. Ebi mo ho no mo say sexual intercourse. Obi also so say oni obi and have you but the water closet they don't use school near there no and they sa near me ba my three things are etimi this ade ne ba unconsciously like on having sex but these three things apart from so Maame dey awo na e hye ho no these three things can bring this upon you are wonye aware of
exactly nti eno no ye normally candida albicans omo ye white mo no but gonorrhea and chlamydia dey sex untumi nya without sex nti yen set ho no clear nti white ne dey environment now on so dey kan bi okọ junso bia na se jana bia na ho nyi neat nti no normally hygienic conditions obi onye hygienic obi come na situmi fusa obi ho ne pants on sesa
I know dey enye no kwa
esipa nti and most of the time no ohun say ma your peritoneum maybe a to kwan no ase kwan no very close nti bacteria me feel to ho jana mbewura
potogins ne ho
and now baby on pa say be so clean a o yesen kode connection de bananim so the more free to be fat na se ho so those are the issues obi on so a so be say ho bie and ho eketo de ma hye ho so they all create environments na de ma gu nso mtantan mu na de no bi fa ho na create environment and monitor better na ho because a ho no pH ne hyew no e we bi ese gina and say oh my pH no esesa how acidity sesa you call for some bacteria to come and stay there and hygiene pa
no open invitation
we be kwan into a lifestyle no obi on so an system no is so weak in fact body no immune system one day we talk about it immune system the boy ho ban pa and e bi o ase ho no so more na ho system no ye weak no because you mo e bo ho ban check wo say bibia metna o system no weak no mu free ho the bad ones will come and occupy then no so be how adwene.
You are watching the biggest and the largest. Inti sesi enu yehu say so bi benya all this discharge na baby nkakra ebetumi free ho no mu ayeden aba wa chire mu sesi enu wo topic ne ye wo se nye ni nyina na ye infection. Inti now take us through to your topic.
Inti yemfa with a man first yemfa man no. Because ma te hu sa ne pa now wo your best di hu yi pa. E me nka Maame Grace. Wo your ba ya ta hye panta clear. Be so much who the crow. Don't put on colored panties because fluid be never at every time of your cycle. So for instance, one say your bar na say ovulate here. Ovulation no time I say between your bar be me share be time or two kusia or baby or time on based on a cycle. We born cycle 21 days. We born near 28, we born 35. The time of this month no and next the ye can 17 year pass and get the bia no be hu e ba within a period in your cycle ntumu say bia na e wase for kakra sa the ye can su kwan e megu pantin pi e bia just a drop it doesn't smell anymore and no my tire white or clear e bi okra sticky ase kusua ne eyi no be no aha sa part na ye white sa na hu no internet show say u tu kusua is one infection because of tu kusua no your hormones different estrogen echimo sa estrogen echimo no ene mo hu that slimy we na eba no nti hu a ento american ko kaso onya infection ko pedranum na so be mistake afa two say unya sexual arousal say o kon do so no be hia emi mpo ana we dme mana be na be sibitim some moment about him the body is preparing you say okay say I drink ho de any o say your hammer and ube produce mu Cosbee ebeba ntenu so be hu a don't think say it's an infection. And then thirdly, a money bitter issue IUDs, any implants, any adenura, Emma warmer, and a contraceptive space maybe some are hormonal. Then your hormonal and the but the hormonal also to him those discharges. A beam will be how you sue irritants, never be the far as home so home shisho, and a heart shiny idea. All those ones has problem. In the end, I can echo distorted a hot temperature, a hot pH, by so doing. A hobby releasing so because what could affect a whole system no. Now, obi on so ya na empempi no when your infection no you bacterial nte hobby maybe ko your infection ko if I be post infection conditions e mo ne baaye no omoko bom be gya nsuo ni fi bi o sports any parcels dibo se no so no abo ne kona fe no so ye den API aba to clear off everything nti the MS ne say sa ne mana hospital or go to lab but I say empempi na ye call first Tanzania call sanema no obeko pharmacy na drug stock pay drugs no hospital or lab into who are they say what inside that lab or hospital then you check and see and confirm say they body and the can no she no say enya dia de bia obehu it comes sometime once in a while be neko and I'm saying say a more and na MF4 CP afenye so colored say be a brownish, greenish or that can be a clear or white. Nti hu ni sa catch us no ade we die physiology system physiological condition me na ekoso or hormonal issue bi. But wadwe mu ntin wa na make no yenye lab test in hwade to confirm.
Say yare ana enye yare. Say dia wa kire mu ye de enye yare. Ma mimbisa we na ewi aya ba de yare no so. You see after menstruation now that there is this stinky thing that comes after that so they have so many things to douche to it's believed that when you douche and all that now a cleaning hall blah 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 the douche and it doesn't also invite anything there.
You see you don't have to system young situation no wa set it body no say no operating on itself on shout anko hanon ko bibia. Se unya menstruation we are na ye part of the blood na ye so light na came na say ba no so clear chi no ama na besin nti
so sa bon no ye ntumi friend say yare
David anya yare so leave it after be 2 or 3 be okay but whereby be a ko be week or 2 stay na ho it is coming about more pampa then you need to look into it by just menses no sometimes can be before tiningi na ye menses no ho ne mani bia which have to clear everything out now you free. If you know who you are, no, person you be to ensure say be a certain before. Oh yes, sir, but so do you know? You might call distortion at the vagina. Be say ho temperature no, any hormone at no. Then be your problem.